On the outside, it appears to be a simple exercise in teamwork and coordination. But there is something much more complex happening here at this 2-day training event organized by the Eastern Iowa Mental Health and Disability Service Region.
Dr. Robert Macy with the International Trauma Center.
Dr. Robert Kinshirf, I'm the Executive Director of the Center for Law, Brain, and Behavior at Massachusetts General Hospital, Harvard Medical School.
Nationally known experts are connecting with frontline counselors and educators who specialize in dealing with children and their families facing so many challenges.
My name is Christine Gradert, and I am the Director of Child and Adolescent Services for the Robert Young Center and also the Children's Services Coordinator for the Eastern Iowa Mental Health and Disability Services Region. So whether you live in Clinton, Jackson, Scott, Muscatine, or Cedar, or a small town or a large town, we want to make sure that we as a region are bringing the best resources we can to bear and partnering with our sister agencies to make sure that children and families are supported.
They are doing that by sharing the latest research and tools being used to help families heal, creating moments that are changing lives here in this room, so that they can in turn help promote more healing and hope in their communities.
Sometimes it's a longer percolation, if you will, and sometimes we will do these for 1 or 2 days, and it's at the end of the second day when somebody comes and says, on the first day I was listening to all this stuff, but I didn't really see how all of these pieces fit together, and I didn't see how this was going to fit here where I live and work, and you're going to get on a plane and go away, but I'm still going to be here. But now I understand why Christine is bridging us together, why I need to think about how I do my job a little bit differently or with a little more respect and cooperation with somebody else who I now need to collaborate with and not work in parallel with. So that's immensely rewarding.
They give us 6 or 8, 7 hours of their time and they're still engaged. You know that they're taking it in. And when they ask us questions like, okay, how do we do this tomorrow? And they're willing to do it and they're ready to know how to translate our toolkits into something that's culturally appropriate for their people. That's just really gratifying. I think for me, my most favorite though is I've been able to work in some residential facilities here in Iowa and neighboring states, and when you see a kid over a couple of years transform from the kid that the whole system was going to literally throw that kid away, and they turn 18 or 19, they're living independently, they get their first apartment, and they remember us and the team that was there for them, that's really gratifying. In other words, this stuff works.
As a professional who's practiced my entire life in our region, this is very gratifying. We've done a lot of good work in the past, but we have to keep growing based on the new knowledge and the new science around neurobiology. And to bring these folks in, our trainers, Dr. Macy and Dr. Kinshirf, is just really helping us take it to the next level.
And the reviews? Eye-opening. The best workshop I've been to in a long time. Amazing. Good thinking outside the box. And this is just the beginning.